3 over-the-counter drugs that all seniors should avoid. Hi, my name is Doug. I've been a physical therapist for 30 years and I specialize in helping people with balance problems. In this video, I'm going to share with you the 3 over-the-counter medicines that all seniors over 65 should avoid. There is a class of medications called anticholinergic drugs. These are drugs that help people who have allergies, who are having trouble sleeping, or who are having dizziness or nausea. They're very commonly prescribed and taken. But this class of drugs is known to cause dizziness, unsteadiness, it increases your fall risk, and recent studies have shown that it actually can increase your risk of developing dementia. Here are the 3 drugs that you want to avoid. The first are drugs that contain diphenhydramine. Examples of this are Benadryl, Tylenol PM, Advil PM, and Unisom sleep gels. Next are the over-the-counter medications such as Dimetapp, Bromax, and Lordane 24. These are medications that contain the chemical brompheniramine. The last are medications that contain dimenhydrinate. This is a drug most commonly called Dramamine. Anything in the anticholinergic drug class blocks a neurotransmitter in our brain called acetylcholine. Acetylcholine transferase is used to conduct signals through the brain. So by blocking it, it helps reduce the effect of certain problems like allergies or an inability to sleep. It basically slows your brain down just a little bit. A study that was conducted on 3,500 people that were over the age of 65 tracked them for 10 years, and it looked at whether or not they used any anticholinergic drug throughout the 10 years, and it gave them cognitive tests at various intervals over 10 years. What the study found was that out of the 3,500 people, 800 developed dementia. The study found a significant relationship between taking anticholinergic drugs and developing dementia. Now that's a big problem. The study showed that you have a 54% greater risk of developing dementia if you take drugs such as Benadryl or Dimetapp or Unisom. Anticholinergic drugs are prescribed a lot. They're used for many different conditions such as COPD, incontinence, asthma, Parkinson's, even cardiovascular disease, vomiting, allergies, and depression. The class of anticholinergics is a big one. The purpose of this video is just to educate the public that if they're getting an over-the-counter medicine, especially if their doctor is not prescribing it to them, they should be aware that if you're over 65, taking those medications does have a greater risk of causing you to fall, and possibly there's a relationship with dementia. So if you can avoid these medicines, it's probably a good idea to do that. There are several websites that you can go to on the internet where you can put the medications that you're thinking about taking into it, and it can tell you whether or not it's an anticholinergic. One of the biggest is the ABC website, which was set up to do just that. It tells you you can put in all the medications you're taking, and it can tell you with each medicine if it's in the anticholinergic class and what level of anticholinergic it is. And it's a good idea to do this if you're over 65, because a lot of times you might have more than one doctor that's prescribing you medicines, and you might be taking over-the-counter medicines that your doctor's not aware of. So sometimes the best person to know about all this is you. So if you can take the time to look it up, it might actually be something that will help you in the long term. One of the things that the research shows is that it's really the long-term use of anticholinergics that gives you the greater risk of dementia and fall risk. So I highly suggest that anyone over 65 look at the medications they're taking, both the over-the-counter medicines and prescribed, to understand what the risks are and then discuss it with their doctor to make some better choices. I hope you found this video helpful. If you want to see more videos like this, please subscribe to my channel. And if you would like to work with a therapist or trainer that's trained in the techniques that you just saw, they can go to proprioceptiverehab.com to get training from me in exactly how to do this. I offer a course in proprioceptive rehabilitation for physical therapists and personal trainers.